This is a session on treating depression, diagnosis, and treatment choices. My name is Bowen Chung. I'm a child psychiatrist by training, so I see adults and children. I work at Harbor as well as at Rand, and I'm a part of this study.
And all of you have met me earlier today when I was talking on the collaborative care panel. So my name is Michael Ong, and I'm a general internist, and I practice at UCLA. And I'm also working on the study as well. So we thought that it would be good for us just to get a general sense of the kinds of people who are in our room and what sort of issues you are also interested in. We have here some slides that talk about the process of assessment as well as treatment choices, and primarily we're going to be talking about medications, but there are two different paths in terms of treating depression, one being medication and the other being psychotherapy. And I think that it's also important to recognize what our clients or patients are most interested in, because not one treatment is not going to fit everybody, and we want to make sure that we find the right kind of treatment for our clients. So should we pass around the microphone and
so we get a sense of what background people have, so we can maybe tailor the talk.
Yeah, so this microphone doesn't actually amplify anything, but it actually just helps the person on the camera actually pick up what you're saying. So why don't we go ahead and just start up with you right here.
Hello, Nomsa Kalfani from St. John's Wall Child and Family Center, licensed marriage and family therapist, and I am the chief operating officer at St. John's. So we have actually moved forward with integrating mental health into our primary care practice. So I work with the development and implementation of that project.
Elena Fernandez, and I am the Integrated Behavior Health Director for St. John's Well Child and Family Center.
Good afternoon, everyone. I'm Edna Bush. I'm the Director of Case Management for Queens Care Family Clinics. We use the PHQ-9 to assess our patients for depression, and it's a must for diabetics especially. But the most frustrating frustrating thing for me, being a case manager myself, is that we have no mental health services, and the Department of Mental Health that we refer to do not see depressed patients. They have to have a diagnosis of schizophrenia or split personality before before they can be seen. So what do we do with these patients? We refer them to the county. They wait months and months and months before they get seen. We only have Zoloft in our formulary. We don't manage medications. So it's really, really frustrating. We do the depression screening. We know they're depressed, but that's all we can do. There's a lot, and 40% of our diabetic patients, think about this. We are in an economic turmoil. It's recession. They've lost their jobs. They have no money. Their A1C is up to the roof, and their blood pressure is like 180 over 100. The last thing they want is this depression, but they are depressed. So I am depressed too. Thinking about the patients that we have, homeless. Anyway, thank you.
I'm Bonnie Myers, and I'm the Program Director for Behavioral Health Services in Hollywood, and we treat substance abuse clients, and we're operate at a clinic for the Department of Mental Health, so we also treat mental health clients as well.
Thanks, Bonnie. Alan Stillman, Clinical Director for Para Los Niños. I'm an LCSW. We have a contract with the Department of Mental Health for children and families, similar issues with diagnosis for children and families. Depression is usually dealt with but not necessarily labeled. We have a full range of clients, and we are continuing to try to reach out to both the children in our school system and in our own schools at PLN, especially in a crisis manner.
I'm Barbara Linsky with the Assistance League's Hollywood Senior Center. You heard from me before, a little bit about my harangue. I'm also interested in medications, complications caused by numerous types of medications that seniors are getting involved with, and the results of over-medication.
Good afternoon. I'm Elizabeth Smith, and I'm an elder at First Presbyterian Church of Hollywood. I'm also the immediate past chair of our health cabinet for the last 10 years. My background is nursing administration, hospital administration, and public health administration. And we're really interested in finding that we're kind of breaking down the barriers to depression at our church. Last year, May, we had a very successful depression seminar. We had 135 individuals who attended it with great feedback, and I really feel that it would be wonderful for us to take it to the next level. So I'm here to learn more as I possibly can in order to coordinate other programs to help the community at large. And I just want to also mention that we do have a collaborative with Hollywood Mental Health and other entities, because we do have a large homeless population in Hollywood. And we're really grateful for the collaboration. It surely works. Thank you.
Hi, my name is Melissa Custer. I'm a community liaison public health nurse with Los Angeles County.
Hi, my name is Peter Mendel, and I'm also part of the CPIC project as well. I'm from RAND.
My name is Veronica. I'm with Queens Care Mental Health. I'm a case manager, and I'm just interested in the topic, how do you treat depression?
Hi, I'm Sylvia. I'm also a mental health case manager for Queens Care. And I am interested a little bit on the medications, too, because I get questions about and concerns with the mothers as far as the side effects that it has, and they don't even want to treat the child sometimes because of the side effects, and the child sometimes goes untreated because of those choices.